So welcome. Hey, have a look at this. So pre-GIEQs VI, precursors of upper GI cancer, things you can miss, which might mean that your patient, after your gastroscopy, where you saw nothing, ends up getting cancer. One of them is Barrett's esophagus. It's one of the three big premalignant conditions which we can have problems with in the assessment of the upper gastrointestinal tract. So let's pull back here and have a look. I've got a cap on the endoscope. We take a freeze. Always take a freeze of everything you do. You see, just abutting the gastroesophageal junction, some squamous mucosa, a bit weird, in the middle of a relatively long segment of Barrett's esophagus. Measurements are critical, so we get our orientation correct. How do we do that? Well, we come into the stomach, we find the antrum, we find the lesser curve now at the 3 and the greater curve at the 9. We come back, keep the orientation stable into the esophagus, and now we have everything at the clock face orientation. So we see that there is this area of squamous mucosa in the 2 to 4 o'clock or 2 to 6 o'clock. That's very expected because that's where the acid is pooling. We also see that it's pretty red and there's a bit something strange going on with the pattern in the 3 to 6 maybe o'clock arc here. As we come back more, the overview of the rest of the Barrett's looks completely fine. So what can this be? So maybe at first pass we see nothing here, but I can tell you for sure there is dysplasia within this Barrett's esophagus segment, and there is in fact high-grade dysplasia within this Barrett's esophagus segment. So looking in Barrett's esophagus is very important. Having an idea about what you're looking for is very important. In this colon we have this idea about blink features, and I think it's quite similar in the upper GI. You're looking for distortion, which we don't see. You're looking for extra redness, and you're looking, when you see extra redness, which we see here very clearly abutting this ulcer here in the freeze now, right in the middle of the image, then we're looking to look closer. And one way of doing so is acetic acid. I'm not going to do that here because we're planning to do a resection of this. But if you just look here under virtual chrome endoscopy, when we compare that area, which you now see in the center of your screen, where it's starting to become disordered, the pattern that goes towards the gastroesophageal junction, you compare it to an area of relatively normal Barrett's esophagus where the pattern is pretty regular, and actually maybe here not. So let's select a better area, maybe over here. We see quite maybe a little inflamed here, but more regular, whereas in this area there's quite a definite line, demarcation line here at the 6 o'clock, where beyond it we see this quite abnormal area which extends into an area where there potentially is quite a lot of disorder here. Now in the center of the image, and maybe that's a biopsy site, maybe it's not, but all this area needs to be removed for histopathological analysis. So key features of this gastroscopy which make it high risk: 1, the presence of Barrett's esophagus. How do we mitigate missing things? We use a distal attachment. We look very carefully all the way around the gastroesophageal junction. We spend at least a minute per centimeter of Barrett's observing closely. Any areas of extra redness which draw the eye require further interrogation with lots of images, both images up close like this, but also magnification type images like this, also with virtual chrome endoscopy imaging like this, and also overview images to contextualize the situation in the neutral position so that people have a reference point. And so an overview image is very useful to get an idea of how long the Barrett's is, where the gastroesophageal junction is, and where the problem is related to that. All right, well, this is going to be a big topic of the first day of GIEQs VI, so if you're interested, or you want to be able to do it like that, or you want to be able to break it down in your head so that one day you can just do it effortlessly like that, please join us at the end of September to find out more. I look forward to seeing you there.